part of Guwahati by the Brahmaputra, Janitva IVF brings new hope to families dreaming of parenthood. With advanced technology, expert care, and personal attention, every journey is guided with love and trust, serving families across Northeast India and beyond, because every story deserves a happy beginning. Don't miss a doctor's live on NLTV Saturday 5:30 p.m. with Dr. Arpita Sarmah, MD ONG IVF consultant, Janitva IVF Center. Learn about IVF infertility and the path to parenthood. Guwahati thakia Janitva IVF to bishi family nimite ekta nutun umeed ase kunkan ama baba hubule sapna dikhi ase. Modern technology, experts, doctors are bishi bhal dekhbhal logode idu suffer bharosa aro care bra borta ase. Northeast India aro aspas laga desh tak seva kore kile mane sob kahani te ekta khushi laga shuruat deserve kore. IVF ikan in vitro fertilization or parenthood laga journey halbra jani bole Saturday 5:30 p.m. day Naglin TV ke join kuribi Dr. Arpita Sarmah, MT ONG IVF consultant, Janitva IVF Center, Taibra IVF fertility treatments opor expert insights share kuriya hamibo.
Hello viewers, so manuge Nagaland TV, the Doctor's Life Day swagat korisi. Job our episode ke continue korigena aji aro Dr. Arpita Sarmah IVF consultant, Janitva IVF Center Guwahati logot mohan jurigena ase. Job our mohan women's reproductive health RTG fertility la topic upor de kota korise. Idu nishinai idu topic te continue korigena aji aro itu lode jura alak case khan upor mohan Dr. logot kota koribo. Dr. logot kota nakurai kite ekta chudu khobor sob manuge janai dibo. Mohan som anu to viewers English or Hindi do napare aro khali nakamiste ase kunba manu bishi jun idu nishina he mahala guest wi tai nakamis phaba na jane do idu garne mahan paratha so idu topic ekta bishi important topic ase idu garne sob manu bujule garne mahan English Hindi nakamis tinta bhasha bi milai ke na kota kurbo so that so manu bi audience khan bi phal ba idu topic to phal ba jan knowledge babole garne mahan koshish kurbo to IB viewers Dr. logot kota kurbo. Welcome, Doctor. Thank you so much. Again, we are continuing this thing. So last time we spoke about fertility and other aspects of women's reproductive health. So in continuation with that, what are the other factors that could affect the fertility in women?
Okay. In previous talk, we talked about tubal factors and male infertility. The other factors that contributing to female infertility could be the uterine factors. See, if the tubes are normal, okay, there is no tubal block. Now we will concentrate in the uterine cavity of the female reproductive system, the uterus. The uterus is the thing where the place where the pregnancy occurs. So we'll try to rule out any factors, any pathological factors in the uterine cavity, as well as we will see the ovaries also. Okay, so in ovary there could be PCOD or ovarian cyst. That these both factors contribute to female infertility, and in uterus there could be some pathological factors like uterine tumors, and we call them fibroids. So those are the factors we have to rule out. If the tubes are normal, then we will see these factors are they contributing to it.
So mohan idu cyst or ovarian cyst, how will we know that idu mohan ke cyst asiguna man kinga janibo?
Ovarian cysts are diagnosed in ultrasound. अल्ट्रासाउंड में हम लोग डायग्नोस कर सकते हैं. So the important thing is that there are two types of cyst. So the people get panicky if the ultrasound shows this ovarian cyst and they are thinking about surgery and all. This is not at all the truth actually. So there are two types of cyst. The one is functional cyst that goes away with naturally, or with some medication it goes away, and the another one is chocolate cyst that is harmful to fertility. It secretes some kind of fluid like that that causes adhesions and tubal block, and it affects the fertility of the woman. So first we need to diagnose what type of cyst is that, and it is totally diagnosed in ultrasound.
Okay, so before we go for diagnosing it, like Dr. Lotte diagnose na kora kite, what are the symptoms that we know that okay, moi jai na doctor ke dikhabo lage, kilole man bishi ba mahan na jani na etu khan to, because it's all medically test khan korina man janu to ki symptoms ase that one will know that okay, moi Dr. Lotte jabo lage.
First, she will have irregular cycles. Okay, so she should notice that if the cycles are getting longer. So if she is getting 28-day cycle, she might have 30-45 days, or she might miss the periods also, like without this pregnancy. The second thing, she will have pain during menstruation. So this is called dysmenorrhea, increasing pain, and each cycle she will have increasing pain. So that's a symptom that it might be a pathology in the ovary. Okay, so then she should go to a gynecologist and check whether if there is anything wrong with the ovaries.
So idu man test kurishi aro doctor ba diagnose kurishi cyst ase, ovarian cyst ase ngosha. So what are the next step? Man idu looking at treat group, man idu like dawai hi khaina phal group na man surgery ngabi jawo like ibo idu kanya.
So if the ultrasound is telling that the cyst is functional cyst, so that's a normal thing. Okay, so we'll give a course of oral contraceptive pills for a period of 2 or 3 months, that goes away, those kind of cyst. Okay, but if the ultrasound report is telling that it's a chocolate cyst or endometriotic cyst, then it's an alert and she should be observed. But this suppose the cyst is very small, so that woman should not go for surgery actually. So they get panicky about the ultrasound report, and the doctor also, some doctors, that they tell that this is going to harm you and you should go immediately for surgery. And see, each ovarian surgery will take away the eggs also with that. Okay, the patient should be very alert that if surgery, if I am going to do a surgery, ovarian surgery, so I am going to lose the healthy eggs also with that surgery. Okay, so the decision is very tricky, and she should be very conscious about this decision and should consult a fertility specialist also, whether I should go for a ovarian surgery or not. If the cyst is not more than 7 centimeter, the woman should not go for surgery, or if the pain is very severe, then we might have to call for a surgery. Otherwise, surgery is not needed for each and every ovarian cyst. It will harm her fertility actually.
Then for this surgery, what are the types of surgery that one can undergo, or is there just only one type of surgery, or there are multiple other types of surgery?
Actually, otherwise now presently we are doing only laparoscopic surgeries for ovarian cyst. We shouldn't go for this open surgery. Okay, so just with the pinhole we can remove the large cyst also. And it's only 24 hours stay in hospital, blood loss is also minimal, it's very patient friendly. So yeah, and within 7 days she can resume her work and all. So it's only laparoscopy surgery we are going for ovarian cyst.
So this cyst thing, what if can this turn into cancer, or is it cancerous in nature? Na kinaka?
Yeah. So when the ultrasound report tells it's a cyst, so it will tell the kind of cyst also. If it is indicating like it's not functional cyst, it's not ovarian, this one endometrioma and kind of mucinous and cyst like that, then we go for some blood markers for cancers. Okay, so in the blood itself we can say that it might turn into cancerous. Then we take precautions before this surgery and we plan the surgery. Then we'll take a biopsy from the cyst before planning the surgery if anything suspicious about that cyst. Okay, so yes, there are certain cysts that can turn cancerous, so we should be cautious also.
This brings back to our topic. This cysting, will it affect our fertility? Fertility ke do affect करबो ना ना करबो ito? Like how are the chances of
Only
it
the
affecting?
endometriotic cyst, the chocolate cyst affect fertility.
So the other type of
cysts, they do not affect fertility. Okay.
Okay.
So we should first know the diagnosis, the type of cyst. It's not that all ovarian cysts are going to affect your fertility, but chocolate cysts are surely going to affect your fertility. So that way we have to plan the treatment for that couple.
So if a patient, she was diagnosed with a cyst that would affect her fertility, but she did surgery, surgery crochet, or it can remove crochet, everything happened, all this sorted. But what if it reappears? How will it affect? Ito laro scenario.
Surgery, in all cases, surgery will not help. So we should avoid surgery in all the cases. I mean, we should not go for surgery for an ovarian cyst, no? Because it will recur, it will come back. Within 6 months, within 1 year, it is going to come back. So if we need to do a surgery, then post-surgery, after surgery, this 1 year period, post-operative period is very important to get a pregnancy. So we should be very aggressive about the treatment. Otherwise, this cyst is going to come back. Recently, we met a patient, only yesterday only, she did a surgery in Chennai, okay? It was only 3 centimeter cyst, and in Chennai Apollo they did a surgery. She didn't remove the stitches. It was 18 October like that. So now I did the sonography and the cyst is back. Okay, so it's a kind of thing that they will recur within 3 months, 6 months, 1 year. So surgery is not the thing you have to go for each and every cyst. So so we have to plan the type of surgery, and if the cyst is not big enough and not causing any problems, it's not affecting her quality of life, we shouldn't touch it, because it's going to harm her eggs. With each surgery, we'll lose her healthy eggs. So we should be very cautious regarding ovarian surgery.
So by losing healthy eggs, it will again affect her fertility.
Yeah. So it's going to harm the surgeries. The more surgeries, recurrent surgeries, will harm her egg profile.
Okay. This thing brings me back to apni PCOS I mentioned, Grisha, that PCOS and cyst
it's different thing.
It's not
PCOS
interchangeable.
is a health disorder actually, where the patient do not menstruate regularly. Her cycles are longer, and it's because of insulin resistance. It's kind of similar to diabetes. Okay. So because of insulin resistance, this hormonal profile gets imbalanced. So those hormones that cause menstruation, those hormones are low, and the other hormones become very high. So it's a kind of hormonal disorder, and because she do not menstruate, she forms small cyst in the ovary. Those are not cysts actually. She is not ovulating, That's why the kind of picture is like polycystic. Many cyst. So polycystic ovarian disease. Poly means many. So that's the kind of picture we see in the ultrasound. That's we call it polycystic, but it's not cyst. It's not proper cyst. Yeah, it's a kind of hormonal disorder. So she gets obese, and she puts on many different hair and all. So testosterone level goes up. The male hormone are high, and the female hormones come down. So it's a kind of disorder. And we treat it like she needs to modify her lifestyle, lose weight, so those kind of treatment, and it's totally different from ovarian cyst.
So when you are diagnosed with this cyst thing, so apni ito time de apni lifestyle like changes annual like what is there
ovarian
anything that
cyst?
We can...
No, lifestyle has got no role in ovarian cyst. Either we have to treat her with this observation. Close observation, and some kind of medicines also we can give to reduce the cyst, or surgery. Surgery is the last option I could say in terms of fertility. But if the ultrasound report is telling it's kind of suspicious cyst, then we have to plan the surgery as soon as possible.
Then আপনি আরো ইন্টারভিউ মেশন ফাইব্রয়েডস ইন্টারভিউ মেশন করছে সো আই ডু লাভ ইউ অলপ এক্সপ্লেইন করবি না একটু কিনগা আছে কি আছে
The fibroids are the uterus is the place of implantation. I mean, where the women get a pregnancy, na. So all fibroids are not going to harm the fertility. तो सब ऐसा नहीं है कि सब affect करेगा. So those fibroids that are close to the cavity and this is pressing this giving kind of pressure into the cavity, or it is very big, it's causing symptoms like she is having very painful menstruation, like those kind of symptoms are, then we have to remove the fibroid. It's a kind of uterine tumor.
So viewers, Dr. Rasis ay fibroids kan uporde janay di daikse to itulo de alop aro continue ko na man janiwo but it will continue na akrai ki dek ta break loba.
In the heart of Guwahati, by the Brahmaputra, Janitva IVF brings new hope to families dreaming of parenthood. With advanced technology, expert care, and personal attention, every journey is guided with love and trust, serving families across Northeast India and beyond because every story deserves a happy beginning. Don't miss a doctor's live on Nagaland TV, Saturday 5:30 p.m. with Dr. Arpita Sarmah, MD ONG, IVF consultant, Janitva IVF Center. Learn about IVF infertility and the path to parenthood. Guwahati thakia Janitva IVF to bishi family nimide ekta nutun umeed ase kunkan ama baba hubule sapna dikhi ase. Modern technology, experts, doctors are bishi bhal dekhbhal logode idu suffer bharosa aro care bra borta ase. Northeast India aro aspas laga desh tak seva kore kile mane sob kahani te ekta khushi laga shuruat deserve kore. IBM khan in vitro fertilization or parenthood laga journey Fibroid jani bole Saturday 5:30 p.m. day Nagaland TV ke join koribi Dr. Arpita Sarmah, MT ONG, IVF consultant, Janitva IVF Center, Taibra, IVF fertility treatments opor expert insights share kuriya honibo.
Hello viewers, তো আপনি খানকে আরো পর মহালা শোতে স্বাগত করেছে তো ডক্টর লগত মহান ফাইব্রয়েডস উপর কথা কই দেখছে তো ইটো লপর আরো কন্টিনিউ করি না মহান কথা জানি লব So doctor, this apni fibroids la koi dekhe mohan ke then what are the types of fibroids that exist or that a person can diagnose with?
Okay, so fibroids could be three types. Okay, so some fibroids are outside the cavity, means the place where implantation occurs. These are called subserous. Those are least harmful. Okay, they do not cause any kind of harm to the patient. Okay, so some fibroids are intramural, they just close to the cavity, not into the cavity, and some are submucous into the cavity, inside the cavity. So most harmful are submucous. So those kinds of fibroids we have to remove. These fibroids cause severe pain during menstruation. They will have heavy bleeding. Intermenstrual bleeding means outside the mens also they will have some kind of spotting like thing. So those fibroids we have to remove through hysteroscopy. It means we put a camera inside the cavity. There is no operation from outside, just the camera will put inside and will take out this tumor through that camera. So it's kind of daycare surgery. So if we do in the morning, she can leave by evening, like that.
So this the symptoms for these fibroids, idu cyst lo de similar thakina or alap alag thake do.
So this will affect the bleeding thing also, fibroids. So they will have more bleeding during this men's heavy bleeding. So that's one symptom, and another symptom is similar to ovarian cysts. They will have increasing pain during their menstrual cycle. So if the fibroid is very big, then they will have some pressure symptoms also, like frequent urination. Okay, if the fibroid is causing pressure on the bladder, urinary bladder, those kind of symptoms also she might feel.
So now that apni do symptoms kan ki kudi shaman doctor lo de jana treatment kuri share and everything, though idu fibroids karne, do we need surgery or can it be treated with like medical kan dawai kani kaina palu jaw parina man surgery lobo like yeah?
Will depend on the size, symptoms, and whether it is causing any harm to her fertility. Whether the fibroids are causing any harm to the because of the fibroids, whether she is not getting pregnant. Okay, the size, if the size is very big, if it is more than 6-7 centimeter, and that is causing symptoms, and another one is small but causing symptoms, it's close to the cavity, she is feeling very pain, even it is small, we have to remove them. And the third one, if it is affecting her fertility, means it is small or big, the size will not matter, but we'll see in the sonography that it is entering into her cavity and taking the place of pregnancy. So those three factors will consider for surgery. Now there are some medicines also actually that can reduce the size of the fibroids. So we can try with some medicines also. If the fibroid is not very big, then those medicines also can reduce the size and relieve the symptoms also.
Okay, so in that way, it will update on further treatment to jabo whether complete surgery
so
is
that
needed
we can avoid surgery in certain cases. We can try with medicines. If the medicines are not working, then we can plan the surgery.
So idu garne kinga la surgery like what kind of surgery exist for this?
So now even the size of the ovary if the size of the tumor is like 6 months pregnant also, we can remove with the laparoscopy. So we do not go for open surgery nowadays. We just put 3 or 4 cameras, small cameras, pen-like cameras, and even if the size is very big, what we do moscillation, means we just like mixie we grind the thing so we grind the tumor inside the abdomen and we take out in strips through the hole only.
Okay. So is it painful? It will be kind.
No. It's the patient will be under general anesthesia. She will stay in the hospital only 24 hours. Okay, minimal blood loss, and this she can resume her work very early in laparoscopic surgeries. Even the size of the tumor is very big, 14 centimeter, like 10 centimeter, we can remove by laparoscope only.
Okay,
no
then
need to go for
this
open.
brings me to another question. Inga kuratam the straight ko na ulay siya. Is there any chances of like leftover body siya no kumba ulaw para na inga eperbe inga chances hobo na?
No, because everything is seen under this high resolution cameras, so less chances of missing. So everything is done under vision.
Okay,
so it is very beautifully done.
Okay, all right. So this again, idula de ko kurbo. If a person might manufacture idu fibroids to acetylode, she's diagnosed with this thing and everything, but I conceive kursiya. To inga idu situation de ki kurbo lagi. Dai ni dawai kaina hi ko kurbo na surgery jabo lagi.
In pregnancy, see these fibroids can increase in size because of the increased blood supply and all to the baby. They might increase, so she should be under close observation. But we cannot plan fibroid surgery during pregnancy. It might harm her baby. Okay, but in certain cases some subserous, I told you some fibroids are outside the cavity. If they're very big they get twisted, so there might be very severe pain during this pregnancy. Those cases might we have to take for surgery during pregnancy only. Otherwise, we do not touch the with fibroids during pregnancy. We just keep them under close observation.
So let's say it's less harmful one, but it's big and it got twisted. Inga ki hushigulido. It surgery korina or additionally treatment korishigulido. It do our pregnancy ke affect corona na korbo.
No, it is done very carefully under laparoscopy.
Okay.
So as it is outside this cavity now, so we can remove it without harming the baby. But as far as possible, we do not plan surgery during pregnancy. We keep the patient under close observation.
So, type pregnancy, pachado petese, original fibroid. So, it's the one that is harmful to the patient. But it is the observation the hierarchy. Like surgery can equal granite. Then once the baby is born, it will be like how will the treatment go for this one?
Then she can plan a surgery if the fibroid is symptomatic. If the fibroid is not symptomatic, then she can be with that fibroid. We'll have to observe her very closely like that. So because fibroids are very less chances of going cancerous. Okay? There is no fear about that. Very least chance. So they could be under close observation. If the fibroid gets bigger or she becomes symptomatic in between, then we can plan a surgery after delivery.
So idula casing how she little. The second baby quantum the idula or wapas reoccur kurban na kurban
After surgery?
Yes, if she
Yeah,
does
might recur.
surgery.
Yeah. Any kind of tumor and cyst can recur within 2 years.
Okay, so man idu discussion quantum the our last time amli lap akida amli chocolate cyst mention question. The chocolate cyst or dermoid cyst idu ki is ya idula differences to ki se taiju na machotte.
Dermoid cyst is a totally different type of cyst. It's a kind of tumor from the germ cell of the ovary, okay, and we have to remove that cyst.
Dermoid
It
cyst
might get cancerous.
Okay.
Okay, so if we diagnose dermoid cyst and even it is very small also, we have to keep the patient close observation. If it is more than 3 centimeter, we should plan out surgery for that lady.
So, what if it's less than 3 centimeters? Like less,
If it's very small, okay, then we can keep her under close observation. It is less symptomatic. She will not feel any kind of symptoms. It is slow growing, but it might turn cancerous.
Okay.
It's
Even
a kind
those-
of different cyst. It contains teeth, hair inside the cyst. It's a very
Okay.
different kind of cyst. So it's not good actually. So those kind of cysts also affect fertility. It's totally different from chocolate cyst. Okay.
Okay.
It's a kind of birth defect like that. Okay. It occurs from the germ cells of the ovary. And it should be removed laparoscopically.
Let's say like tala idu cyst la it's like smaller in size, okay. But then tala pain to komti thagibo na mane
It's
like
very less symptomatic. Dermoid. The patient even do not know that she is having dermoid. If it is, she has come for us for fertility treatment or any other symptoms, and when do a sonography, then we detect as dermoid cyst.
So
But if it grows very big,
okay.
like say, it crosses 4-5 centimeter, it might cause little pain.
So it's
but
like, what are
dermoids
the
are
pains or the symptoms that a person will know? So because like ini body la bhitor de ki hoise mando na chani do, so ina or na mohan ini thaki uli na when the later stage alo bishi wa bijite man chani na. So beforehand, like let's say do amne ko anishna less pain inga thaki, but then ki hushi gule she should go and see the doctor.
Little spasmodic type of pain might occur, not related to mens.
Okay.
Okay, like chocolate cyst, they cause very severe pain during mens. But dermoid will not cause like that. It will cause pain in between mens also. Little pain, dull pain. Not severe, sharp pain.
So
dull pain. So she might feel that kind of pain.
Okay, so
with dermoid.
With this inhalation, it will be apne fertility ke affect kurbo for sure.
Yes. Dermoid will also cause this affect fertility, but they are very less symptomatic, slow growing and very silent.
Okay. ঠিক আছে, thank you. তো viewers, এটা আপনি খান জানেন না ডক্টর লয়ড মদন কথা কইছে আর ডক্টর রহমান কে cyst আর fibroids আর chocolate cyst ইদু খান কি কিসিম terms উপর de কথা কইছে মহান আম জনতা খান মান একু knowledge না থাকাতে ডক্টর রহমান কে ইদু ভালো বুঝাইছে তো ইদু নিচিনা হি আর মহান বেশি টপিক আনিব মাইকি খান লা health related তে তো সাইট থেকে বি নাগলেন টিভি the doctor's life.